Okay, hello, good evening, everyone. I am Dinar M. Dahili, and today we're gonna talk about the part 3 non-narcotics, NSAIDs, and aminophenol. In this video, we're going to talk about non-opioid, otherwise known as non-narcotic analgesics. These drugs are used to treat pain, and there's a couple of different families we'll talk about. These are the non-steroidal anti-inflammatory drugs, or NSAIDs, acetaminophen, and salicylates. So, different non-narcotic analgesics and their indications. Classifications of analgesics. These analgesics is like divided into two groups: the non-opioids and the opioids. We're not going to talk about the opioids. We'll focus about the non-opioids or the non-narcotics. Right now, we're talking about non-opioids, and they act primarily at the peripheral nerve endings, and they work by inhibiting prostaglandin synthesis. That's debatable, not effective for severe pain. Sometimes non-opioids analgesics are exactly what a patient needs. First, we're going to talk about the non-steroidal anti-inflammatory drugs. So, NSAIDs are a large group that are used frequently over the counter and by prescription. Their mechanism of action and many of their pharmacologic effects and adverse reactions are similar to aspirin. They are analgesics, antipyretics, and anti-inflammatories. NSAIDs pharmacokinetics. The kinetics, most of them peaks within an hour or 2 hours, and food might reduce the rate of absorption, but we oftentimes will suggest that patients take them with food to reduce stomach upset. They can also take them without acids if they are already having stomach troubles. And NSAIDs are metabolized in the liver and excreted in the kidneys. So NSAIDs adverse reactions. Gastric irritation, pain, bleeding problems can occur with an NSAIDs. They interfere with the normal protective mechanisms in the stomach, and this results in these GI symptoms. They can even cause ulcer. The CNS side effects are dose dependent, and they can include sedation, dizziness, confusion, and sense interfere with clotting, but not as long as aspirin. They are harmful to kidneys in high doses. These agents are not addicting, tolerance does not develop, and patients don't develop any kind of withdrawal symptoms if they stop taking them. So, drug interactions with NSAIDs. NSAIDs, like aspirin, have been shown to reduce the agents used for high blood pressure. They can also interact with the lithium. Remember, sometimes patients take lithium for bipolar disorders. NSAIDs may increase the effect of digoxin. Digoxin is used for congestive heart failure. It's a drug that has a fairly narrow therapeutic window, and there are other drug-drug interactions with NSAIDs. So before patients are given an NSAIDs, we should check and make sure that we're not creating a problem for them. So, NSAID contraindications and cautions. NSAIDs should be given cautiously to patients with asthma, cardiovascular, or renal diseases, especially if they have fluid retention. Patients with coagulation problems or peptic ulcers or ulcerative colitis should be cautious also in taking NSAIDs. We really need to think about if NSAIDs are an appropriate medicine. All NSAIDs can increase the risk of a serious cardiovascular clotting event like MI or stroke, and all NSAIDs may increase the risk of a serious GI event including bleeding. So, therapeutic uses of NSAIDs. NSAIDs are useful in treating pain, but it's always a good idea to use the lowest effective dose for the shortest period of time. So these are the examples of common NSAIDs. I will not go through them one by one. It will take long, and it will take so much of our time. So I'm gonna just pick a few of them. Here are the more NSAIDs, the examples of the drugs. So let's focus on ibuprofen, Advil, or Matrine. So let's start with talking about ibuprofen. It's the oldest member of the NSAID family, and we have the most clinical experience with the product. Usual dose is 200 to 800 milligrams every 4 to 6 hours, and generally NSAIDs are not used in pregnancy, especially after 30 weeks gestation. Naproxen, naproxen, Aleve. Naproxen, known as naproxen or Aleve, have a slightly longer half-life than ibuprofen. So this can be administered on an 8 to 12 hours schedule, which can be more convenient for a patient. The pharmacological effect and the adverse reactions are similar to the ibuprofen. Let's talk about COX-2 inhibitors, or the cyclooxygenase 2 specific agents. So, NSAID actions is on the COX-1 receptor, and it's the cause of many of their side effects, but not their therapeutic effects. So companies developed a more specific agents that target the COX-2 receptors. COX-2 inhibitors works as well as NSAIDs, but they have fewer side effects. So, here's examples of the COX. Celebrex is thought to be easier on the stomach. It's usually dosed 200 milligrams once or twice daily. There's mixed evidence that here in the photos evidence that links Celebrex or celecoxib with an increased likelihood of a heart attack compared to placebo. But other drugs in that class, like Vioxx and Bextra, were pulled from the market because they were shown to cause an increased risk of cardiovascular deaths. Let's move to acetaminophen. So we will tackle about the pharmacokinetics, pharmacologic effects, adverse reactions, drug interactions, uses, dose and preparations of acetaminophen. So acetaminophen has used this as an analgesic and antipyretic in children and in adults. Its potency is about the same as aspirin, and it's about equally efficacious. It is, however, not an anti-inflammatory, and it does not bind to platelets and doesn't cause bleeding. So, APAP pharmacokinetics, or acetaminophen pharmacokinetics. Acetaminophen rapidly and almost completely absorbed from the gastrointestinal tract, and it gets to a peak plasma levels in about an hour, in about 1 to 3 hours, and it's metabolized by the liver and excreted in the kidneys. And its half-life is about 1 to 4 hours with large doses. There's a metabolite that's thought to be hepatotoxic. Okay, so in acetaminophen's drug interactions and uses, I will not go over this. So the cool thing about acetaminophen is it's remarkable free of drug interaction at usual doses, and again, it's used as an analgesic and an antipyretic. So usually acetaminophen is used an antipyretic instead of aspirin for young children. So AP dose preparation or the acetaminophen preparations. It's available in many combinations in elixir. It's on the PowerPoint. I will not go through over it. Let's move to ASA mechanism of action or the acetylsalicylic acid mechanism of actions. So aspirin, it is a cyclooxygenase inhibitor, and as we've said before, inhibits prostaglandin synthesis. So prostaglandin synthesis basically is a sensitized. It sensitizes yourself to pain. Okay, so it causes inflammation and fever, and it also causes permeability, which cause vascular swelling. Okay, so pharmacokinetics of aspirin. It's rapidly and almost completely absorbed from the stomach and the small intestine. It is widely distributed into most bodily tissues. Aspirin is known to displace a number of drugs from protein binding sites in the blood, and its half-life for a small dose is about 2 to 3 hours, but a higher dose is the half-life can be as long as 15 to 30 hours. As at a higher dose, aspirin has zero order kinetics because a higher dose only a constant amount can be metabolized per hour. So, pharmacologic effects of aspirin. Aspirin relieves mild to moderate pain such as arthritis, headache, or toothache, and it can reduce a fever because it has a anti-inflammatory effect. It stops prostaglandin synthesis. Aspirin irreversibly binds to platelets, which make it effective for prevention of an MI or a heart attack or acute myocardial infarction. Even in the treatment of an ischemic event, if you suspect that somebody is having a heart attack, you can have them chew on one full strength tablet and then, of course, get to the emergency room as soon as possible. So large doses of aspirin have a uricosuric effect which means it can increase the elimination of uric acid, and this is something that's too high in patients that have gout. So, by reducing the platelet thickness, the time it takes to form a clot is prolonged and each platelet is affected until a new platelet is formed, and that's about 4 to 7 days. In children with either chickenpox or flu, aspirin is associated with Rice syndrome. So, Rice syndrome comes with liver and brain toxicity, and it could be fatal, so we don't usually recommend aspirin use in children because the incidence of a true-out allergy to aspirin is less than 1%. So the patient with asthma are more likely to be allergic. That could be 5 to 15%. So aspirin's toxicity. An overdose of aspirin can produce harmful effects and even deaths. A patient can have ringing in the ears, headache, nausea, vomiting, dizziness, dimness of vision, hyperthermia, meaning they are too hot, or electrolyte imbalance can occur. Children are actually the primary victims of an accidental poisoning, and education of parents regarding potential poisoning and proper storage and using child-proof containers will be useful. These precautions has reduced the accidental poisoning in children. So treatment of aspirin poisoning includes getting rid of the drug in the stomach, by inducing vomiting or administering activated charcoal, and the other symptoms were treated symptomatically. Symptomatically din. Okay. So, drugs that interacts with aspirins. Okay, so there has warfarin and antihypertensives. Okay. Drug interactions between aspirin and warfarin can result in bleeding. Warfarin is an oral anticoagulant that is highly protein bound to plasma protein binding sites. If aspirin is given to a patient taking warfarin, it can bump the warfarin from that binding site. That increases the anticoagulant effect. Remember, it's unbound on free drug that has actions in addition. Aspirin affects platelets and makes them less sticky. Bleeding and hemorrhaging may result from these interactions. So, in antihypertensives, aspirin can lower the antihypertensive effect of many blood pressure medicines, including ACE inhibitors or the angiotensin converting enzyme. The beta blockers, thiazide, and loop diuretics. So aspirin has an effect on renal functions, resulting in water and sodium retention, which could also raise blood pressure. Usual dose for aspirin. So aspirin doses. Usual dose for aspirin. Okay, so usual dose for aspirin is usually 325 to 650 grams every 4 hours. So, more commonly used for prevention of MI is 81 ml of aspirin once daily. Okay? So, aspirin preparations. This is, I think, the last slide. Okay. So, aspirin preparations can be combined with buffers, and that is said to reduce gastrointestinal effects. It can be combined with oxycodone, which is a narcotic. That product is called Percodan. And ideally, you are using less narcotic and less aspirin and getting better effectiveness than either one alone. Other examples of combination is fiorinal, and that consists of aspirins, butalbital, and caffeine. Sometimes with codeine, and again, you get more analgesia from the combinations than you would any of those products alone, with hopefully fewer side effects. So that ends my presentation. Thank you.